medical problems leading to inflammation, cellular damage and diseases like cancer. Obesity can sometimes be traced to a medical cause, such as Prader-Willi syndrome, Cushing's syndrome, polycystic ovary syndrome, and other diseases and conditions. Some medical problems, such as arthritis, can lead to decreased activity, which may result in weight gain. A low metabolism is unlikely to cause obesity, as is having low thyroid function. There are two sets of defining criteria for metabolic syndrome that are set out by two different sources, the International Diabetes Federation and the Revised National Cholesterol Education Program. However, this potentially excludes any subject without increased waist circumference if BMI is less than 30. Conversely, the NCEP definition indicates that metabolic syndrome can be diagnosed based on other criteria. Also, the IDF uses geography-specific cut points for waist circumference, while NCEP uses only one set of cut points for waist circumference regardless of geography. These two definitions are much more similar than the original NCEP and WHO definitions. Raised triglycerides, greater than 150 mg/dl, or specific treatment for this lipid abnormality, reduced HDL cholesterol. Raised blood pressure, systolic BP greater than 130 or diastolic BP greater than 85 mmHg, or treatment of previously diagnosed hypertension. Raised fasting plasma glucose, greater than 100 mg/dl, or previously diagnosed type 2 diabetes, if FAPG is greater than 5.6 mmol/L or 100 mg/dl. An oral glucose tolerance test is strongly recommended, but is not necessary to define presence of the syndrome. If BMI is greater than 30 kg/m, central obesity can be assumed and waist circumference does not need to be measured. The World Health Organization 1999 criteria require the presence of any one of diabetes mellitus, impaired glucose tolerance, impaired fasting glucose or insulin resistance, and two of the following. Blood pressure equals 140/90 millimeter of mercury. Dyslipidemia, triglycerides, equals 1.695 millimoles/L and high-density lipoprotein cholesterol equals 0.9 millimoles/L, equals 1.0 millimoles/L. Central obesity, waist-hip ratio greater than 0.90, greater than 0.85, or body mass index greater than 30 kg/m2. Microalbuminuria, urinary albumin excretion ratio equals 20 grams per minute or albumin-creatinine ratio equals 30 mg/g.